America's fight against the pandemic seems to be slowing down right when we need to speed up. Fewer people are jumping at the chance to get their vaccinations. For the first time since early March, the U.S. has dropped below 2 million doses per day. Last month, the nation peaked at more than 3 million a day. Some states are even turning down vaccines. From South Carolina to Washington, this surplus amounts to hundreds of thousands of doses just this week. Despite the slowdown this week, the White House set a new vaccination goal. President Biden wants at least 70% of adults vaccinated at least partially by Independence Day. Joining us now to answer your questions is the president's chief medical advisor, Dr. Anthony Fauci. He is the director of the National Institute of Allergy and Infectious Diseases. Dr. Fauci, welcome. It's good to have you with us.
Thank you. Good to be with you.
Before I get into some of our audience's questions and some of my questions, can I just do a quick gut check with you? I would like to believe that at this point in our fight against COVID, that there's some part of you that's thinking, we got this. We got a lot of ups and downs, but we're on the right track. At the pace we're on, we got this. Is that how you feel, or are you still a little pessimistic?
No, I do feel that way, Joshua, for the most part. I still want to make sure that we don't declare victory prematurely. Because as you just said, we really need to get more people vaccinated. We want to hit that 70% of adults getting a single dose by July 4th and even go beyond that. So we're on the right track to where we want to be. So in that regard, I do have that feeling that we got it. But we want to make sure we don't look the other way and let it get by us. We got to stick with it, with the public health measures, and we got to get as many people vaccinated as we possibly can.
This morning on another network, you said that it's probably time to begin relaxing some of the indoor mask mandates. What's going to be the data point for you that lets us know that it is the right time?
Well, the CDC is going to be coming out in a rolling fashion with recommendations as we get more people vaccinated. And as we do that, without a doubt, you're going to start seeing the cases coming down even more so. Just a couple of weeks ago, we were averaging 60,000 cases a day. We're now down about 42,000 cases a day. It's still too high to feel great about it, but it's going in the right direction. And as it continues to go down, the CDC is going to be relaxing the guidelines, both in indoor, the workplace, things like that. So we have that to look forward to. So if we want to get back to normal, what we need to do as a community is to get vaccinated.
We got a number of questions from our audience, which we'll go through in the next few minutes, including several questions that have to do with children, particularly siblings. One of our viewers, Kendra, asked, if an older sibling is fully vaccinated, is it okay to sign him up for an indoor sport like basketball or ice hockey before his younger siblings are eligible for a vaccine? Or should we hold off until everyone in the household is fully vaccinated? Dr. Fauci, this gets to some of the science, which I think is still kind of emerging, about how the vaccines affect children rather than adults.
Well, you shouldn't refrain from having one member of a family do something because another member is not vaccinated. The fully vaccinated person can do things according to the CDC guidelines, which means they can do almost anything outdoors except go to a very highly concentrated number of people, like in a large stadium for now. Everything else from an outdoor standpoint, fine. Indoors, it really depends on the level of infection in the community. As the level of infection in the community gets lower and lower, the risk to a person gets extremely low. Being vaccinated itself is going to markedly diminish any risk, whether that risk is outdoor or indoor. And again, that's the thing we want people to understand. The risk becomes dramatically diminished. As far as the unvaccinated child goes, again, follow the CDC guidelines of what you do if you're unvaccinated.
One mom asked on Twitter, I got the J&J vaccine 4 weeks ago. My 10-year-old is high risk. We haven't left the house in months. Now that I'm vaccinated, if I do go shopping, out to dinner, or travel, how likely is it I could somehow infect my son? Also, how soon can he be vaccinated? Dr. Fauci?
Right. Well, the risk is not zero, Joshua, but it is extremely low. So the fact that mom is vaccinated diminishes dramatically any risk to the child. I would want to know how old the child is because, we are getting to the point where we will very soon be vaccinating kids who are adolescents, namely the high school age.
I'm sorry to interrupt. She says she's 10 years old.
10 years old. Well, yeah. 10 years old, we're probably going to have to wait a little bit as we get into the fall and get that child. If the mother says the child is at high risk, that's an even more reason to get that child vaccinated to prevent the kid from getting to the point where they're at a high risk of getting a severe outcome.
These are great answers to some of our viewers' questions. Mick has a question that I think a lot of people are asking as it relates to just getting the whole country or as much of it as possible vaccinated. Mick wants to know, if not enough Americans get vaccinated, can newer unknown variants not covered by current vaccines put fully vaccinated people at risk of getting COVID? I think what he's asking is, as we kind of push toward herd immunity, which we may or may not hit, this gap of the people who don't become part of the herd, for lack of a better term, might become a weak spot that allows variants we haven't developed medicines for yet to sneak in and basically kind of ruin all our hard work with getting people vaccinated. Doctor, what would you say to Mick?
That's a great question, Joshua. Absolutely. That's the reason why we want to get as many people vaccinated as we possibly can. If you have a vaccinated person and a variant comes in, fortunately for us, the variants that have become dominant in the country happen to be quite susceptible to the vaccines that we're using. But that doesn't mean that sometime in the future, we may get a variant come in from another country or some other place and wind up putting people at risk, even though they are vaccinated. Another really good reason to get as many people vaccinated as you possibly can. So far, all the questions you've asked are pointing to what we're trying to do, getting as many people vaccinated as possible, as quickly as possible.
Can you just clarify something for me? I think I understand this, but I want to make sure that I have this right. In terms of some folks' hesitancy about getting the vaccine, I feel like part of it had to do with the speed with which the vaccine emerged. We discovered SARS-CoV-2, began to categorize this disease, quarantining, isolating, social distancing, and then within a year's time, we've got vaccines and they work super duper well. So it felt like it kind of came out of nowhere. But my understanding is that there had been years of clinical research about coronaviruses that aligned at just the right times. Like they say, luck equals preparation times opportunity. We had done all this preparation, and then the opportunity emerged to apply that basic science to a real threat. And so it looked like the vaccines came out of nowhere, but really they were the result of years of work that coalesced at just the right time. Do I have that right?
You have it spot on, Joshua. We had identification of the virus in early January, and by the time we got to December, we were putting vaccine doses into people's arms. That is unprecedented in its speed. However, it was antedated by literally decades of research, both on the vaccine platform technology, such as the mRNA and the adenovirus, as well as decades of research on coronaviruses and other viruses getting the right confirmation of the immunogen to give you a very potent vaccine. So things did not start on January 2020. January 2020 was the culmination of decades of research that anteceded that.
Thank you for clearing that up. I appreciate you helping to make that make a little more sense. A few more quick questions I wanted to ask, including this one from a viewer about travel. The viewer asks, I have family living in Europe, in the Netherlands, that I would love to hug again. Do you foresee a lift in the travel ban with Europe and or vaccine passports in the near future? Dr. Fauci, we know the G20 countries have already kind of started contemplating the possibility of some kind of, for lack of a better term, passport, some kind of proof of vaccination for international travel. But what do you see?
Well, certainly there's not going to be vaccine passports. That's going to be at the federal level, Joshua. There might be airlines that will require you're showing proof of vaccination. There may be companies that would require it. We know that colleges are already talking about a requirement for verification of vaccination, but it's not going to be federally mandated. Regarding the question, if you are fully vaccinated and you go to see a relative wherever they may be, yes, absolutely, you can be in there. You don't need to wear masks in the confines of a home, and you could have physical contact.
A few more quick questions before I got to let you go. Next month is the 40th anniversary of the first CDC article about the disease we now know as AIDS. This is the 40th anniversary of that, those cases of pneumocystis in gay men in Los Angeles. You have been with the federal government since the mid-'80s fighting AIDS and other pandemics. Do you think that what we've learned with fighting COVID-19 could help us fight HIV/AIDS, maybe help us develop a vaccine for that virus, or are they too different?
Well, no, it goes both ways, Joshua. In fact, the work on the structural biology and the structure-based vaccine design, working for years on an HIV vaccine, was extremely helpful in us getting a vaccine for SARS-CoV-2. Going back in the other direction, the platform technology for vaccines, the mRNA particularly, that proved to be beyond our expectations successful, we're going to start using that platform technology in HIV. So one is helping the other back and forth. Really a good example of how science helps one field versus another field.
And Dr. Fauci, I just got one late question that just came in from my mother. I'm going to be a good son. It is Mother's Day. I'm going to give her the last question. She asks, how likely is a second booster? Dr. Fauci?
Well, first of all, please wish your mother a happy Mother's Day.
I will.
And I will answer her question. Yeah, it is, likely, I think more likely than not, that we may need a booster because the durability of protection is unclear right now. And it is entirely conceivable that after a certain period of time, that could be a year and a half, where the durability of the level of protection starts to go down. If that's the case, it makes perfect sense to consider a boost.
I can't tell you how much I appreciate the work you've had to do over the last year or so trying to explain all of this complicated emerging science, especially with QAnon and conspiracy theories and all the weird, screwy, dark corners of the internet kind of competing with you and your expertise. But we appreciate you making time to answer some of our questions. Dr. Anthony Fauci, thanks very much.
Thank you very much for having me, Joshua. Appreciate it.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.